See our screen here, our title slide, pelvic health in the childbearing population. Yep. Okay. Great. Yeah, I got a thumbs up there. Perfect. Okay, and we're recording. All right. So welcome, everyone. My name is Emma Conron, and I am here with my colleague, Tess Crusp. And we are both registered physiotherapists and pelvic health therapists at Burlington Sports and Spine. Before we get started here, I just wanted to thank all the local F45 studios for collaborating with us and promoting this event throughout the week. We're really happy to have all of you guys with us this Sunday afternoon. As of right now, we have about 32 people here, but we'll see kind of how that goes as people join. But I'll just kind of go through what we'll be talking about today. So we're going to be talking about pelvic health physiotherapy. What is it and who should go to pelvic health physiotherapy? We're going to be talking about the pelvic floor and the anatomy, kind of how it functions and what are signs and symptoms of dysfunction. We are going to be talking about exercise during pregnancy, and then we're going to talk about our role as pelvic health physiotherapists in preparing for birth, recovering from delivery, and returning to F45. Now, as I mentioned just previously here, we will check in and see if there are any questions as we move along, and we'll open up the floor for questions at the end of the presentation. But if you think of something throughout and want to write it down, just put it in the chat and we will periodically check in there. All right, so let's get started here. So let's talk about pelvic health physiotherapy. So pelvic health physiotherapy is a specialized field of physiotherapy focused around treating dysfunction of the pelvic floor muscles. You'll sometimes hear this being called pelvic floor physiotherapy, but I personally prefer pelvic health over pelvic floor because we have a role not only in treating the pelvic floor muscles and pelvic floor dysfunction, but how our whole body influences how these muscles work. We also have a role in providing education on biological and lifestyle factors that contribute to symptoms. So pelvic health therapists, so people like myself and Tess, we both have our master's degree in physiotherapy, and then we have completed postgraduate training in pelvic floor rehabilitation. We are both registered with the College of Physiotherapists of Ontario, and we are rostered to perform internal examinations. This part of our training really sets us apart from all other rehab and fitness professionals. So let's start by just talking a little bit about the internal exams and that component of pelvic health physio. So internal exams are not mandatory, but they are recommended. And I like to kind of explain this by referring to another body part. So if someone were to come in and see me for their knee, they've been having pain or problems with how it's functioning, and I was seeing you and I was looking at every area around the knee. I was looking at your hip and your ankle, but not actually touching or seeing how your knee itself is working. And then I put together a treatment plan and said, there you go. You'd probably be thinking, well, you never even looked at my problem. So how do I know if what you're giving me is right for me? So if we put that back to the pelvic floor, if you're coming in with some typical complaints that are related to pelvic floor dysfunction, and I don't actually touch or take a look and see how they're working, then I'm unable to give you the most beneficial and individualized plan for you. So that's kind of how we're able to do that. The internal exam, it's a digital exam. So a lot of people ask me this when they come in is, do we use speculums? And the answer is no. So it's just purely with our fingers or digital. So a lot of people who have had it are very relieved and find it a lot more comfortable than if you were to get a PAP, for example. The internal exam can be done both vaginally or rectally, or a bit of both. And it really depends on what the complaint is. And as we go along through treatment, the kind of progress we're making. So I know rectal exams can kind of be intimidating for a lot of people, but if people are presenting with tailbone pain or constipation or things like that, it can be very helpful, but both of them are in our toolbox. So when we are doing an internal exam, some things that we're looking for are we're assessing your pelvic floor function. So what is the tone of those muscles? How strong are they? What is their endurance like? Are you able to coordinate your pelvic floor muscles with other muscles in your body? We assess for pelvic organ prolapse. So that's something we're going to be going into a little bit more detail later on in the presentation. We are actually able to palpate the cervix and the tissue around the cervix. So that can often be an area that can cause pain. So we can look at that. And then we can also look at some of the deep hip muscles. And these are also can be often sources of pain in a lot of people. So it's a great way to take a look and really give you an individual program that way. The rest of the assessment for pelvic health physiotherapy is actually very similar to an assessment that you would do for an orthopedic or musculoskeletal assessment for any other body part. So if you were to come in for shoulder pain or knee pain, we would always take a history of your complaint. So with pelvic health, we're taking a look at your medical history, your gynecological history, your sexual history, your bladder and bowel function. We take a look at your posture and your breathing mechanics. We take a close look at your back, hip, and pelvic mobility and strength. And then we use all of that in combination with what we find in the internal exam to make a program for you. So this here is just a picture that I really like because it just illustrates what most people think about when they think about pelvic floor physiotherapy. So a lot of people often go to, Kegels and internal exams, but that's really just the tip of the iceberg. When we look underneath the water, we can see what it really is. And it includes things like pain regulation, breath work, postpartum rehab, prenatal care. You can see all those other things, and that's what we're going to be talking about a little bit today.
All right, guys, so we're going to talk a little bit about what the pelvic floor actually is, the roles, the various roles that it has within our body. Essentially, the pelvic floor just refers to a group of muscles that sits at the underside of our pelvis and deep within our pelvis. So I'm just going to use my handy little pelvis model here. So we can see on the underside, these are some of the tissues of the pelvic floor. This just outlines here, this is our vagina, and then we have the anus. If you look kind of from the top down as well, you can see that there's several different layers of the pelvic floor muscles as well. And they're kind of shaped like a bowl almost, like sitting underneath our pelvis. So you can imagine that that bowl kind of helps to support the organs that sit within our pelvis in here. So that would include things like the bladder, the uterus, the rectum, all that good stuff. The pelvic floor also contributes to the sphincter muscles. So we can see here, like surrounding the urethra and the anus as well. So that would contribute to our continence, which just means our ability to control when we start going to the washroom and when we stop going to the washroom. And that's something that we commonly see dysfunction in during pregnancy and after delivery. The pelvic floor also helps to contribute to muscle tone. So during things like sex, it helps with blood flow and just increasing muscle tone. The pelvic floor itself also is a really great stabilizing structure for our pelvis, but also for our hip and our low back. So I'll give the example here. We've got our pelvic floor kind of sitting as that bowl structure in our pelvis. And then right in the one area of the pelvis here, this is a deep hip muscle that overlies the pelvic floor muscles on the inside. So because they're so closely associated, we also have a lot of contribution of stability from our pelvic floor to other structures like the hip and the low back as well. Finally, we have what we call a sump pump function of our pelvic floor. So that just kind of refers to the ability of our pelvic floor to generate pressure and regulate pressure within our pelvis. So that helps to return venous, so like blood fluid and lymphatic fluid away from our pelvis. So it really helps with like pelvic congestion and stuff like that too. And we just wanted to talk about the forms of dysfunction that we tend to see within the pelvic floor. So I just want to point out that it's not always very black and white or like one size fits all. Sometimes we tend to see these overlapping, or like depending on the area of the pelvic floor we're looking in, might see one or the other. But typically we see hypertonicity and hypotonicity. Those are the two main forms of dysfunction. So hypertonicity, that just refers to muscles that are overly contracted and tight. Whereas hypotonicity in the pelvic floor refers to muscles that are overly lengthened and have low tone, so they have a tougher time generating force. I do want to point out though that even with hypertonicity, with that tighter pelvic floor, we also see issues in generating force, because if the muscle is too contracted or too shortened, it can't generate the same level of contraction that a muscle at like a very optimal length would. So both of these types of dysfunction, they can cause a whole array of symptoms, and we might tend to associate certain symptoms with one or the other, but the treatment's going to differ very much for the two of them. That's why it's really important, like Emma mentioned, to do a comprehensive assessment and do the digital internal exam. Even if you're presenting with certain symptoms, it might not mean that you have one type of dysfunction or the other. We are the best way and the gold standard to really figure out which type of dysfunction that you have so we can give you the appropriate treatment. So for both of them, there's definitely exercise involved. Just being rehab experts, rehab professionals, exercise is a go-to, but the type of exercise is really going to differ. So for that hypertonicity, that tight pelvic floor, we're going to look at relaxation techniques and stretching techniques to lengthen the muscle. Whereas for hypotonicity, we're going to be looking more into strengthening programs. So that might be like what you would consider your classic Kegel, for example. However, again, I want to just reiterate that Kegels aren't for everybody. It's not a one size fits all. There are actually instances where doing a Kegel could be more harmful than it could be beneficial. So for example, if you're having some leakage of urine, say with like coughing, sneezing, whatever it is, and you automatically think, oh, well, I'm leaking urine, so my pelvic floor must be weak, so it must be low tone or like lengthened, hypotonic. But really, it could be quite the opposite. It could have hypertonicity or an increase in tone. And the reason that you're leaking is because it's overly tight and can't generate enough force to be able to control the opening and closing of those sphincters. So if you were to do Kegels on top of an already really tight pelvic floor without addressing any lengthening or stretching, you could actually make things worse in the wrong direction. So it's really important to see someone like myself or Emma and make sure that it's really individualized for you. Okay, any questions? I know that was kind of a lot there. If anyone wants to stop me in the chat, please do before we move on.
Looks good.
Cool, okay. All right. So we're gonna talk about some different reasons why you might wanna see a pelvic health physiotherapist. I just wanna point out that today we kind of marketed this presentation as like catering to a pregnant or postpartum population, but there are so many other populations that can benefit from pelvic health physio. So people of all ages, you know, we tend to see, especially young female athletes who are really overly active, they tend to hold a lot of hypertonicity and they might have a lot of pelvic pain, especially with things like inserting a tampon, for example. That could be a good example of why to see a pelvic health physio. Also, older women or women who are going through menopause tend to see a lot of changes within their pelvic floor just due to the hormonal changes. So that would be another reason. Men as well can benefit from pelvic health physio, whether it be due to penile pain, post-ejaculatory pain, or just like any history or of issues with the prostate that can really get in your way to have a healthy pelvic floor. So with that being said, we'll just kind of jump back into the pregnant or postpartum population here. So some of the reasons or like signs of dysfunction that I have listed here, they might be really obvious to you. So things like leakage of urine or feces. So especially with like sneezing, coughing, jumping, laughing, exercising, basically anytime we're generating force through our abdomen. If you're having even a single dribble of urine, that's considered dysfunction. So while that's very common to see during pregnancy and after delivery, it's absolutely not normal, right? Our bodies were not meant to leak urine, and you should be able to do all of those things without having any leakage. So that's a definite reason to see somebody. Something as well like urinary urgency, just that refers to having to pee right now and you can't hold it. So you have to pee, you got to go now. You struggle to get to the washroom, you struggle to sit down on the toilet on time without dribbling a little bit. Or if you're just going really frequently and you're finding that you're having that urge more than 8 times throughout the day, anything above 8 is considered abnormal or frequent. That would be another reason too. Pelvic organ prolapse, Emma kind of touched on this earlier. So this is also very common after delivery, and it just refers to the descent of some of our pelvic organs past the opening of the vagina or anus. So that could be like seeing your actual uterine tissue, for example. If you see it kind of coming through past the opening of your vagina, that might indicate obviously something's going on there. Sometimes it just presents itself as like a feeling of heaviness or pressure or a dragging in your pelvis as well. So that might be a reason to check that out. Pain with intercourse or any insertion. I think a lot of women do tend to kind of associate that with dysfunction as well, which is accurate. It's not something that should be happening. Diastasis recti, I think this is one that's pretty common and well known, just that abdominal separation that we see during pregnancy and after delivery as well. Those are some common things that might alert you to the fact that there might be some dysfunction going on, something you want to get checked out, but there's also a lot that we don't necessarily tend to think, oh, okay, pelvic floor dysfunction. So some examples of that are constipation. This is a big one. A lot of people think it has more to do with diet and fluid intake, which obviously do play a huge role. But it could also be due to an increase in tone in your pelvic floor. So just having really, really tight muscles. It could also be positional. So maybe you're not putting your body in the most optimal position to have a bowel movement. Or if you're finding like you're really straining to have a bowel movement, that's not something that we want to see happening, because that can put a lot of load on your pelvic floor. Things like low back pain, pelvic pain, or hip pain. I kind of outlined earlier how closely associated the pelvic floor is to some of the deep muscles of your hip, but also of your back. So if you're having low back pain or pelvic pain or hip pain, if you're doing stuff for it, you're already rehabbing it, if you're seeing another healthcare professional and you're not finding that it's improving at all, it could very much be due to dysfunction in your pelvic floor as well. So that's something to check out, something we want to rule out and make sure we're adequately treating if that's the case. Vulvar pain just refers to pain outside of the vagina, around the vulva. Bladder pain syndrome is pain associated with going to the washroom, like urinating, or just pain around the bladder, kind of like a burning sensation a lot of the time. And aside from that, just prevention. So a lot of women who are pregnant just want to make sure that they're kind of keeping up with the demands that their baby is putting on their body. Obviously, there's a lot of changes with pregnancy. We get an increase in load on the pelvic floor and just the general core. So it's important to make sure that our muscles continue to function optimally so that we can have the best recovery possible afterwards. So that's a really great reason as well, if you just want to stay on top of it and prevent a lot of these things from coming on. Any questions? I know that was like a whole lot of information there.
Chat's empty.
Cool. Okay. Yeah. Okay. So we'll just talk here about a study really quickly. I mentioned that low back pain or pelvic pain could be a sign of pelvic floor dysfunction, and this study just really highlights that. So this was a study that was conducted out of McMaster University. Essentially, they wanted to see how many women who were coming to physio with pelvic pain or low back pain also had pelvic floor dysfunction. So they included 85 non-pregnant women in the study. So all these women were going to physio with some form of back pain or hip pain or pelvic pain. And what they found was that of those 85 women, 95.3% of them had some form of pelvic floor dysfunction. So it's huge. Like, that's very significant. It's a really big number of people. And that tells us that it's very correlated, right? So oftentimes we're treating the low back or the pelvis or the hip, and we're finding like nothing's really improving, especially with women. That can often be because there's a lot of dysfunction going on in the pelvic floor that hasn't been addressed. So nothing else is really going to change significantly until we address that. Okay.
All right, so we're going to change topics a little bit here to exercise during pregnancy. So the latest Canadian guidelines on exercise and physical activity during pregnancy were released in 2019. And in this guideline, they highlighted 6 different recommendations. So we'll just go through those here briefly. So the first one here is that all women without contraindication should be physically active throughout pregnancy. And this includes women who are previously inactive, women who are diagnosed with gestational diabetes, and also women who are categorized as overweight or obese. So that just means that if you weren't inactive before, being pregnant is not an exception to beginning a physical activity program. What I just wanted to highlight here is the word contraindication. So a contraindication is a condition that serves as a reason to withhold a certain treatment. And in this case, that treatment is exercise. So examples of these conditions are things like preeclampsia, or for example, a higher order pregnancy. So if you were expecting twins or triplets, and these are things that your OB would go through with you as well. So let's move on here. So the second recommendation is that pregnant women should accumulate at least 150 minutes of moderate intensity physical activity each week. And this is actually really no different from the guidelines for any adult in terms of how much exercise and physical activity we need. The only slight difference here is that moderate intensity, whereas in the general adult population, we're looking at a moderate to vigorous intensity. So I know we have a lot of F45 members on the webinar here today, and I just want to highlight that you can definitely continue throughout pregnancy and just use your coaches to your advantage to help with modifications just to bring that intensity down a little bit there. The next recommendation here is that physical activity should be accumulated over a minimum of 3 days per week. So basically, we just don't want to get all 150 minutes in one day. We want to spread them out. Number 4 here is that pregnant women should participate in a variety of aerobic and resistance training activities. So again, what's great about F45 is we have both those cardio and resistance days. And I know I've personally skipped a Monday, Wednesday, or Friday to avoid a cardio session. But unfortunately, pregnancy is not an excuse to skip a cardio day. So we still need to get both that aerobic and that resistance training in throughout our pregnancy. All right, number 5. So pelvic floor muscle training. So this one's particular to us and to our topic here today. Pelvic floor muscle training may be performed on a daily basis to reduce the risk of urinary incontinence, and instruction in proper technique is recommended to obtain optimal benefits. So I just want to highlight here the example they put. They put example Kegel exercises. And as Tess has mentioned previously, we now know that Kegels aren't a one-size-fits-all prescription. If you're having any sort of symptoms like the incontinence or pelvic pain, Kegels may or may not be for you. So getting checked out by a pelvic health physiotherapist is the best way to know what exercises you should or shouldn't be doing. And then the last one here, pregnant women who experience lightheadedness, nausea, or generally feeling unwell while they're exercising flat on their back should modify their exercise position. So once again, shout out to our F45 coaches. They're awesome at giving modifications. So if anything you're doing is not feeling right for you, just ask them for modifications. And with that being said, we're also great resources. So we are able to modify as well if you want to talk to us as well. Any questions about exercise during pregnancy? I'm just checking the chat here. I don't see anything. So
Okay, we're going to talk about what pelvic health physio might look like during a pregnancy. So I just want to point out, obviously, during a pregnancy, your body undergoes so many changes. So it's really important to prep the tissues and work with them as well as they kind of increase the load on our abdomen, on our back, on the pelvic floor, all of that good stuff. So kind of as a preventative measure, but also as we see some issues start to arise with pregnancy. You're muted, right?
Yeah.
Okay. Yeah, so one of the things that we will talk about is some common symptoms that tend to come along with pregnancy. Obviously, not every woman experiences these things, but it tends to be more common than not. So things like low back pain, pelvic girdle pain, and sciatica. Just as the biomechanics change of your body as your baby grows, we tend to see more load on certain tissues than others. So we're really great at kind of guiding you through that. Emma and I, aside from our pelvic health work, we're also just orthopedic physiotherapists, which means we treat everything, every part of the body. So we're really great resources for things just outside of the pelvic floor too. We just like to really take that whole body approach and make sure that we're considering everything. Incontinence is something that we tend to see start to arise during your pregnancy. So as your baby grows, you've got quite a lot of load on that pelvic floor, and it just tends to increase and increase throughout the pregnancy. So it's really important to work with that and make sure that we're keeping up with those high demands on the pelvic floor by strengthening it and making sure that it's able to tolerate those loads so that we don't see incontinence happen, or if it's already happening, we can help to deal with that. Pain with intercourse is a common complaint during pregnancy as well. Again, there's just so many changes and your tissues are adapting to so many things that we tend to see lots of tension in certain areas. So we're good with some certain hands-on techniques that Emma and I can do ourselves, but also with specific exercises to deal with that kind of thing. Okay, we'll talk about core awareness and training too. So as your body's changing, we're getting lots of stretch on some of those abdominal muscles and on the pelvic floor. So it's common to start to lose a little bit of that mind-muscle connection that you might have felt really strongly about before you were pregnant. So we give you lots of techniques and different ways to gain awareness of that core and keep awareness of the core, which also includes the pelvic floor. And we teach you how to train it throughout your pregnancy so that it stays really strong. Exercise modifications, I'm already touched on that pretty well, but it's important to really stay active during your pregnancy. So we're a great resource to keep you active, regardless of what changes you might see happening or what symptoms you're dealing with. Again, your F45 coaches are awesome for that too. Labor is obviously a big event, so it's important to prepare for it. And one of the things, obviously, we know that labor is a very high pain experience. And as physiotherapists, we're experts in pain. So we're really good at dealing with pain. Obviously, we're not going to make your labor a pain-free experience, unfortunately. I wish I could do that for everybody, but we can really prepare you for it. So one of the things that we really look into is, okay, perfect. One of the things that we look at as well is while you're in your labor experience, regardless of what that looks like for you, whether it's a vaginal delivery or a C-section, helping to really keep your pelvic floor relaxed. So this especially goes for a vaginal birth, but as you're pushing, a lot of women think that they should be like contracting their pelvic floor and kind of bearing down, when really we have to allow our pelvic floor to relax to make room for the baby to exit. So we can teach you how to relax and lengthen your pelvic floor outside of a labor experience that you're not like in the moment, not sure what to do about it. Obviously, it's good to be prepared going into it. With that too, we look into some techniques to help to reduce the frequency and severity of tearing during labor. So some of that involves, like I had already mentioned, the pelvic floor relaxation technique. So the more that we can allow the pelvic floor to lengthen and make room for that baby, the less tearing we're going to see. But there are also certain hands-on techniques that we can do before your delivery to reduce the frequency of tearing. So one thing I'll touch on here is perineal massage. So there was a study that was done on perineal massage and its role in preventing tearing. I just want to quickly highlight too on my model, the perineum is just the area between the vagina and anus, just right here. And that tends to be the most frequently torn during childbirth. So starting at 35 weeks gestation, the study found that if you begin perineal massage in that time period, that can reduce the severity and the frequency of tearing. Oh, got that one in? Okay, perfect. So one thing is Emma and I can obviously perform those techniques for you when you come in for your appointments, but more importantly, we can teach you and your partner how to perform them so that you feel most comfortable and kind of get the most out of it as well. Finally, we can also go through different delivery positions, so different ways that you can reduce load on your pelvic floor and different structures of your pelvis. So we can kind of guide you through various positions, and then you can be your own guide during your birth or work with your midwife or however it is that you're delivering. Okay, finally, we are going to talk about immediate postpartum activities. So I think a lot of women, at least a lot of the women that I've treated, have reported that they have their baby and they get checked to make sure everything's safe and healthy, and then they're sent home and they're kind of just left in the dark, like, what do I do now? Especially when it comes to rehabbing their body. There's been this huge event to your pelvic floor. Birth is quite a traumatic experience on your pelvic floor. Like, it can induce a lot of trauma and lengthening and tearing and stuff like that. So it's important to rehab that as well. So we'll just kind of guide you beforehand onto knowing like what's safe once you get home, when you should be starting certain activities and kind of the intensity of that, and what you can do to get going right away. Again, lots of information. Does anyone have any questions before I move on? Okay. Okay. All right, so let's talk about now pelvic health physio after your delivery. I kind of started to bridge into that a little bit. But yeah, let's talk about what that would look like. So with your delivery, regardless of the method that you deliver your baby, it's a really big event and it induces a lot of changes on your body and especially on your core, which includes your pelvic floor. So just want to use an analogy here, like just like if you tore your ACL in your knee, obviously that's going to have a big impact on your function. So you would think immediately like, oh, I have to rehab this. I'm going to go see someone to make sure that I'm doing the right things to rehab my knee, whether it's a surgery or, you know, conservative method, doesn't matter. You're going to rehab that knee. Same thing goes for your pelvic floor. When you give birth, there's quite a lot of change and trauma to the pelvic floor. So it's just like an injury, right? You'd rehab any other injury the same way, if not more important for your pelvic floor too, because it's so integral to our function with so many different things. So again, there's some common symptoms that tend to come in this period, like low back pain, pelvic pain, sciatica. Once again, we're pretty well equipped to deal with those types of things. Incontinence becomes more prevalent in this time period too. And like I pointed out, it's very common, but it's not normal. So if it's something that you're finding is happening, it's something we have to address, absolutely. Good. Okay. Pelvic organ prolapse, we've touched on that as well, which is just the descent of those pelvic organ tissues. So that might be something that you can actually see when you're going to the washroom, or again, feeling that pressure or heaviness. So for this, it's very much like an education point. We're going to teach you what you should be looking out for in that first 6 to 12 week period. So if those symptoms do arise, you know how to properly identify them and then how to seek help by seeing someone like myself or Emma. We've talked about that core awareness and retraining. Again, the sooner that you get to it, the better you're going to be able to establish that mind-muscle connection, right? It's like after an injury, the quicker that you can get those tissues firing again, the stronger that connection is going to be. So same thing happens with the core. And especially with something like a C-section, the muscles in your abdomen are also compromised. So we need to make sure that that heals well, and that also those muscles can start to fire again properly. Again, just with the scar stuff, whether you've had tearing or you've had a C-section, we can help to educate you on some techniques and also perform techniques to make sure that the scar heals really well, and so that the muscles underneath it can continue to function really well too. We will talk about guidance for returning to daily activities as well. So just like you're not going to go from sitting on the couch every day for however long to running a 10K, you're not going to go from delivering a baby to super high intensity exercise the next day. So there's definitely a very gradual approach. A lot of women, again, are left in the dark about what's safe and what they should be doing in this time period. But there's a lot that we should be doing even in the first 6-week period after you give birth, just to start to set your core and gain that awareness. So we are a really great resource in letting you know exactly what you should be doing in that time period and how we can get you back to whatever it is you want to do, whether it's running, F45, any other high intensity stuff that you might want to do. Oh, sorry, there's one more thing as well. So other things that kind of don't seem related to the pelvic floor per se, like some clients that I've had have talked about pain just because of breastfeeding, like due to the position, but also their growing baby. So things like that we can address, right? Like Emma mentioned earlier on, we take a very whole body holistic approach. So we're not just looking at one thing, we're making sure that everything's functioning optimally. Cool. Okay, any questions there? Oh, we have one question here.
Oh, I'll read it. Will you be talking about what can be done for menopausal women who find jumping difficult when exercising due to dribbling? So for today, we are talking about more of the pregnant population. However, this question here with jumping and dribbling is still relevant to what we were talking about with incontinence and getting an assessment done of the pelvic floor to see if your pelvic floor is either that hypertonic or that contracted position, or if it's lengthened. The dribbling can be attributed to either one of those. So we'll be answering more questions and we can maybe tackle this a little bit more. And I'm going to be commenting on this during exercise right now. So if that question doesn't get answered, we'll bring that back during the question period. Okay. So let's talk about returning to F45 postpartum. Or any sort of high intensity activity. So running, CrossFit, whatever your choice is, this is relevant to you. So the first ever set of guidelines for women returning to exercise postpartum were released in 2019. So here I've just outlined a few considerations as we start to bridge into more higher intensity exercise. So we want to wait at least 3 to 6 months postpartum before we even consider that. And that is really just to allow for the natural healing timeline to take place. So whether you had a cesarean delivery or a vaginal delivery, you need to allow those tissues to just recover. And that's the amount of time it takes before we even start considering some of this F45 or running. Other things we take into consideration here is your previous level of fitness, the kind of activity level you had during or before your pregnancy. As I just mentioned above here, your birthing method and any complications you may have had may just affect your timeline and how we progress and how quickly we progress. And then your core, so that includes your pelvic floor, and your lower body muscle strength and endurance is also important to look at as we return to exercise. All right, so here we are now looking at your checklist as you begin to return to exercise. These are things you're going to want to monitor. So here we have no urinary or fecal incontinence prior to or during your workout. So basically, if you're having any dribbling or peeing or even any feces leaking while you're exercising, we're going to have to take a step back and kind of reassess that way. No feeling of heaviness or pressure in the vagina prior to or during your workout. So this is related to pelvic organ prolapse, as Tess was explaining earlier. With that being said, pelvic organ prolapse, you can exercise with it. Again, it's about being able to manage the pressure that's building up in your abdomen when you're doing exercises like heavy lifting or you're jumping, just learning techniques to be able to manage your symptoms as you're doing your exercises. And then when you're outside of your workout, you can work on other exercises more physio related that way to help to manage the actual prolapse itself. We don't want to have any ongoing or onset of vaginal bleeding that's not related to your period during or after attempted exercise. So if something like this is happening, you'll want to follow up with your OB or your midwife and get that looked at. And then also, we don't want to have any pelvic pain or low back pain prior to or during your workout as we return to that high intensity exercise. All right, so now let's go over our checklist as your pelvic health physiotherapists. So specifically to the pelvic floor, things that we're assessing for are your pelvic floor strength, so your ability to produce a contraction. And then we also want to be looking at your pelvic floor endurance. So you can have a really strong pelvic floor, but are you able to use that strength for a 45-minute workout and carry that on without having any symptoms happening like the leaking that we've been talking about? We would do a pelvic organ prolapse assessment. It says here negative, but again, even if you have a little bit of prolapse, that's okay. We just want to make sure that you're able to manage it during your workout. So how to manage what we call intra-abdominal pressure is really important as we move forward through exercise. And then again, no evidence of incontinence. So we do a couple tests in the clinic here. If everything's good, then your pelvic floor is good to go that way. All right. Now, aside from the pelvic floor, or I guess this is even a little bit pelvic floor related, but some non-pelvic floor based testing. These are some load and impact tests that we would go through in the clinic as well, and check to make sure that you're able to complete some of these tests without any pelvic or low back pain, heaviness, dragging, incontinence. So things that we're looking at are you able to walk consistently for 30 minutes? Can you perform a single leg balance or stand on one leg for 10 seconds on each side? Can you perform 10 reps of a single leg squat? Can you jump on the spot? Can you do some forward bounds? Can you hop in place? And can you perform A steps? So some of these will look familiar to exercises you'll do in the studio. And we kind of want to clear you here in the clinic first before we send you off into a full 45-minute workout. And then the last thing I just wanted to talk about today is the strength. of your lower body muscles. So this is equally as important, but weakness in these areas does not necessarily mean you can't exercise, but it is useful to identify weaknesses and areas for improvement. So when we take into account the gestation of pregnancy and the time needed for our tissues to recover after delivery, we are looking at over a year of lower intensity exercise and modifications. So our muscles are not as strong as they once were prior to pregnancy. And going back to high intensity exercise right away puts us at risk for other musculoskeletal injuries like a hip, knee, ankle injury, things like that. So these tests here help to assess our strength for those muscles. So the ones we listed are focused mainly on the calf and the hip muscles. So the calf muscles are an important muscle group for jumping activities. And then the hip muscles are a very important muscle group. So here we have some single leg bridges, some single leg sit to stands, and some side lying hip abductions. So lying on your side and lifting that leg up. The hip muscles provide a lot of stability and motor control to our entire lower extremity. So having good hip muscles, good strong hip muscles will help to prevent any sort of lower body injury as well. Okay. Yeah, so let me read that here before we move on. So what types of exercise modifications would you definitely say pregnant women should consider? Example is jumping and or core exercise safe. So I'd say that's a pretty person-specific question. So everyone is different with that regard. As you progress through pregnancy, you're going to notice things like jumping and core exercise are going to be harder and harder to do. So the best thing to do is to monitor your symptoms. That's number one. And then monitoring signs as well. So for example, with core exercises, while you're pregnant and then immediately postpartum, one of the concerns that Tess mentioned was that diastasis recti, or that abdominal separation. One of the things we look for with that is something that we call like doming or coning. So basically down the midline here, you'll start to see a little bit of bulging happening. So that's something we really want to be aware of as we do core exercises. We're not so concerned with the gap that has historically been the most concerning thing for women, as much as the tension that you develop within that gap or that dome. So if you're noticing you're getting that doming happening and you touch it and it's kind of squishy, that is a reason to modify for sure. But just to go back to the question here, there isn't really any specific exercise I'm going to say. I know sometimes people say no crunches or no planks, but there's no evidence that says you can't do those things. You're just kind of looking at your own body and how it's responding to the exercises you're doing. Okay.
Okay. So we're just going to go through some stretches that we find really helpful for the pelvic floor, just for like mobility and lengthening in general. Okay, yeah. Just gonna stop sharing my screen there for a second. So if everyone wants to just click on Emma's video so that they can see what she's doing. Perfect, okay. So like I said, we're going through some exercises here that are just really general for the pelvic floor in terms of increasing mobility, but also with lengthening. So these again are pretty generic, and if you were to be in the clinic working with myself or Emma, we would definitely go way more into depth with these in terms of actually involving your pelvic floor with it. So like helping to specifically breathe into your pelvic floor and mobilize it and lengthen, and we make sure that you're doing it correctly. Today we're just like very generally going over some stretches that we find target the pelvic floor pretty well. Just keep in mind it's kind of more broad in general today. So feel free to join in if you want, or you can just watch Emma, whatever your preference is. But we're going to start lying on the back here. We're going to do a stretch for a muscle called our obturator internus, which is just one of the muscles that lies deep within our hip. You can see it on the pelvis here. So it lies very close to the pelvic floor and helps with overall pelvic floor mobility. So you're going to hug one knee into your chest while the opposite leg just stays straight. Emma's going to grab onto the knee with one hand, on the outside of the foot with the other. She's going to press her knee out and away from her chest as she pulls the opposite foot up to her shoulder. So you can hold this as a static stretch for a good 30 seconds, or you can do what she's doing here and turn it into more of a dynamic movement where she's pressing or pulling into her shoulder and then releasing gently and repeating. You'd want to do a good 10 repetitions if you're doing it dynamically, or 30 seconds per side if you're just holding statically. So this is a great one to target just hip mobility, but also helps to stretch one side of the pelvic floor at a time really nicely. Perfect. Okay. Next up, we're going to do something I know everybody here probably knows how to do. We're just doing a downward dog. So again, we would really target this to your pelvic floor. This will just show a good position here. So Emma's going to come up onto her feet and her hands and just try to lengthen her back, really grow tall through her sits bones, stretch them up towards the ceiling. So she's kind of pumping out her calves right now, getting a good stretch to the back of her legs. You can also just hold and try to stretch through your upper back. She's making this more dynamic by pressing into a plank and then coming back into it, stretching really tall each time. Awesome. Okay. Next up, we're going to come into a pigeon stretch. So Emma's going to bring one leg forward and have the other one straightened out behind her. You can play around with the angle of the front knee. So if you want to open it up to like 90 degrees or keep it in close, really whatever's comfortable on your hip and your knee here. Emma's going to try to keep her back really tall and then walk her hands forward just to get a good stretch through that glute. So again, tension around muscles that surround the pelvis, like the glutes, the hip flexors, those can all contribute to tension in the pelvic floor as well, because essentially they cause an asymmetry within the resting position of that pelvis just with muscle tension. So if we release some of those muscles and get them moving, that's all great for the pelvic floor too. So I'm just going to just come out of that stretch and switch legs. This one we want to do is more of a static stretch and just kind of hold, hang out for a good 30 seconds there. There shouldn't be any pain. So we never want to push into pain with stretching. Like a nice, solid, almost uncomfortable stretch is okay. But as soon as you get into that sharp pain, then we don't want to push. So if that's the case here, you can always modify by placing like a block or a pillow under your bum just to elevate a little bit. Okay, next up, we're going to go into a child's pose position. Again, I think everyone is pretty familiar with this one. So Emma's going to sit her bum back towards her heels and stretch her torso and her arms out long, feeling like her fingers are trying to touch the opposite wall there. She's going to show a variation here where she opens up her hips, which is awesome for the pelvic floor, just to give it a little bit more length. So her knees are just wide here. Again, if you feel like you can't get your bum down to your heels, you can always place a pillow in between your bum and heels just to make this a bit more comfortable for you. If it's not enough of a stretch, you could always elevate your hands on like a block or a ball, or over to one side like Emma's showing there. Perfect. Okay, last but not least, we're going to do a cat-cow. Again, I think everyone has probably done this one before, but you're going to start in a 4-point position. So you want your hips stacked over your knees and your shoulders stacked over your wrists. Emma's going to start here by curling her tailbone under, rounding out her spine, and letting her head totally just relax and sink down. She's going to hold, and then she's going to untuck her bum. She's going to let her belly button drop towards the floor, and she's going to lift her head up to look at the wall in front of her. For this one, you really want to try to coordinate your breathing as well. So as Emma comes into this flex position, she's exhaling. And as you come into the extended position here, she's inhaling. And this is important for your pelvic floor. Which inhale and exhale is associated with which movement. We would, again, get into that quite a bit more and how to involve the pelvic floor. So here you're going to do a good 5 cycles through, or 10 repetitions if you're counting each as one. And nice and slow. We don't want to rush through this. Perfect. Okay, I'm going to go back to sharing my screen here for a sec. Okay. All right, guys, so that concludes the content for our presentation today. Thank you so much for spending your Sunday afternoon with us. We really appreciate it. And we really encourage anyone who has any questions, either if you want to pop them in the chat now, or if you'd rather have more of a private communication, please do not hesitate to contact myself or Emma. You can DM us on Instagram, you can send us an email, whatever you're comfortable with. If you want a phone call with us too, we're happy to do that. If you're looking for any more information, you feel like this is something you might benefit from and you're just not sure, then we're a great resource to just chat with. So please let us know if anyone has any questions, and we'll jump into that now. I'll take this first one here. Let me just
You muted? All right, so I see a question here from Amanda. So through pregnancy, pre and postpartum, what is a common treatment plan length and what is your frequency of treatment? So how many times per week? So again, it depends on the person and what kind of symptoms they're having. So for example, if you're coming for like preventative type measures or just preparing for labor and delivery, I would say starting treatment probably around 33, 35 weeks gestation is a good time, because that's where the research shows we can start perineal massage with lots of benefits. We can start going through pelvic floor relaxation techniques. We can assess your strength of your pelvic floor, give you a little bit more guidance that way. And then in terms of how often, I usually see people like once a week throughout that, again, end part of pregnancy. So between 35 to 33 to 35 weeks till delivery. If someone's coming in and they're symptomatic, so they're having a lot of pain or they're having incontinence, again, I don't usually see my pelvic floor clients more than once a week, but it depends on their pain level. So if they're in a lot of pain, I'll usually advise they come in more than once a week to be able to address any issues with manual therapy as well, and just keep pain as low as possible throughout that time. Postpartum, I think Tess mentioned earlier that internal exams, we don't want to do them until you're cleared by your OB or your midwife, which is usually around 6 weeks after. And then in terms of following up, like how often per week, that's probably less frequent. We bring you in, we go through, we see where you're at, we establish your baseline, we give you a treatment plan, and then we follow up like in 2 or 3 weeks every time. And as you progress and get more comfortable with your exercises, we decrease the frequency until you're back to doing your normal exercise routine. So that could range anywhere from like 3 months to 12 months as you progress through. Next question here from Patricia. Is there any information whether pelvic floor weakness could be linked to preterm labor issues? That is a great question. I'd honestly have to check the evidence on that one. I would assume that some preterm labor issues may be related to what's going on in the pelvic floor, but I don't have any specific examples for you, but I'd be more than happy to look that up and get back to you on that one. There were questions earlier on, I know from Rachel, just asking about the menopausal women. If there's more questions about that, I can answer it, but I think a lot of my answers for a lot of these specific questions is it depends on the person and what they're presenting with. And again, going over the importance of getting an assessment done and seeing what is going on with you personally. One thing that can be really helpful that I'll just go through briefly is your breathing. So my go-to phrase is blow as you go. So whenever you're doing an exercise and you have one part that's particularly hard, so I'll do a squat here, for example. The hardest part of the squat is standing back up. So that's when you want to do your exhale, and that really helps to control pressure and can be really helpful in preventing some of that incontinence as well. Okay. Yeah, sure. So I'm going to let Tess take the next question here.
Okay, I'll just read this out. So you mentioned higher intensity workouts are suggested after 3 to 6 months postpartum. Would this include running/jogging also? So this would just depend on the intensity of running or jogging, right? So a jog can be definitely like lower to moderate intensity if you're going at a slower pace and really taking your time. But we would definitely not want to go into a full-on run until at least 3 months postpartum. So a little bit of like a quicker walk into a jog might be okay, like getting up to that close 3-month mark, if we've cleared you to make sure that the pelvic floor strength is there, right? Again, it's very person dependent, like Emma's mentioned. But yeah, typically with with a run, something that is higher intensity, we'd want to wait until at least 3 months. That's not to say that you can't start to graduate up towards that though before that timeline. And in fact, we actually would encourage that, because you don't want to go from doing very little and mostly just like isometric or like core setting activities to jogging or even a quick walk. So it's all about that nice easy pace up towards it. But yeah, typically with anything higher intensity, which includes running, 3 months is the minimum that we'd want to wait. Hopefully that answers your question. Okay, awesome. Anybody else? We'll hang out for a little bit.
Yeah, if you don't have any questions, thank you so much for joining us today. I have an Instagram account that I post regularly on about pelvic floor and other sorts of rehab tips. It's here, ec.physio, so you can follow me on my journey. Oh, hi, sorry everyone. All right. As I was just saying, thank you for joining us. If you don't have any questions, I have my Instagram here that I post regularly for pelvic health physio and other rehab tips, ec.physio. And then I was also just mentioning just at Burlington Sport and Spine, there's physiotherapists like ourselves, but we also have chiropractors here and massage therapists and all the good stuff that comes along with that. So like acupuncture, concussion management, shockwave, all that stuff. All right. Perfect. Seeing lots of thank yous. Well, thank you, everyone. Again, if you have any questions, you can DM me on Instagram or send us an email. I think Tess has your email there as well. So we're always open to answering any and all questions you may have. One thing we didn't cover today is it is covered by insurance. If you're curious, pelvic health physiotherapy is claimed the same way as regular physiotherapy. So if you have benefits for physio, you have benefits for pelvic health. So take advantage of it. Even if you're not having symptoms, come in, see us, and we'll tell you kind of where you're at that way.
Can I just say something?
Yeah.
Also, we have online booking. So if anyone is interested in booking an initial consultation with us, you can do that online. If you just Google Burlington Sports and Spine Clinic, it'll take you to our website, and you can sign up with either myself or Emma. But if you are a little hesitant or you just have any questions first, like please don't hesitate to let us know, because we are happy to answer your questions. And obviously we know pelvic health physio is definitely something that some people aren't as comfortable with. It's definitely more like personal and invasive, but we, like we said, we take it at your own pace. And how long is the initial consultation? So we do, I believe, 70 minutes for our initial consultation.
I think it was up to 75 now.
Yeah, I think it's up to 75 minutes. So usually it might not take that full amount of time, but there's so much that we have to cover, because like Emma said, like we do a full subjective history. So we talk to you for quite a while, ask you about your concerns, go through a whole medical history and like your current lifestyle, that kind of stuff. And then we do a full hands-on assessment, which includes a screen of every other body part as well. So we look at your spinal range of motion, your hip range of motion, your strengthening, all that good stuff. And then we also do the internal assessment if you're comfortable with it. Again, it's not necessary, or it's not required if it's not something you're comfortable with. And we also don't have to do it day one. We could always like work our way up to that. Yes, we did talk about optimal birthing positions as well. So that's something that we do with the pelvic health physio during pregnancy, is we can go through some different birthing options, birthing positions.
Today,
Oh, like we didn't talk about specifically what they are. Sorry, no, but we just mentioned that that's something that we can work with people as well. Yeah.
I was just going to say, with regards to the optimal birthing position, like Tess said, we didn't go into detail in that today, but it is something we go through. And it's also very dependent on whether or not you're getting an epidural, because if you're getting an epidural, you're going to be lying on your back. But if you're opting not to do that, then that's where we can bring in some other positions that put your body in a less vulnerable position for any sort of tissue damage throughout birth. But I don't have any. Yeah. Okay.
Okay, wait, let me actually pull it up. Okay, sorry. So someone's just asking about how much the assessment is and how much each appointment after is. So an initial assessment, like I said, 75 minutes, it's $130. Appointments after that are 45 minutes, any follow-ups, and we charge $110 per session for those. We are pretty flexible. So we have the option, like Emma said, of being like more creative with our spacing out, so we can do less frequent and make sure that you have a really solid home care program so that you're working on things in between. When you see us, you don't have to see us as frequently. We also can be flexible with our prices. So if you don't have insurance and you think this is something that you would really benefit from, then we have the option of doing discounts and stuff like that. So if you need the care, we're obviously not going to refuse you. Like we're pretty good with being able to negotiate that kind of stuff. What else?
I think that's everything.
Okay. All right. Well, thank you guys so much again. If anyone thinks of any questions after we end the call, again, just send us a message on Instagram or send us an email. Either works. But yeah, thank you so much, guys, for joining us. We really, really appreciate it. And I hope everyone enjoyed it and got something out of today.
Yeah.
Hopefully. All right. Bye, guys. Thank you so much. I think I'll just let other people leave first. So if anyone sticks around with a question, hang out.